Hello and a very good evening to all our viewers who are joining me live in this Facebook and YouTube interaction. I'm back again, and this time I'll be speaking about a particular sequelae, as they term this particular disease that many people who have recovered from COVID-19 are experiencing. And this particular disorder or the ailment is called lung fibrosis. So we'll be speaking about lung fibrosis, but before that, let me give you an introduction of the entire topic altogether. So the doctors from the All India Institute of Medical Sciences, or the AIIMS, have now recommended lung transplant for two patients who have recovered from COVID-19 because of extensive fibrosis, which is a condition where lung tissues harden with lesions caused as the infection heals. So even after the COVID-19 patient recovers, the damage that is dealt by COVID-19 during the time that he experiences the infection has reportedly left a permanent dent on the lungs of these patients. And the country's first lung transplant in a COVID-19 patient was performed in Chennai in the end of August. And while most people recover fully from COVID-19, some experience persistent symptoms like breathlessness, fatigue, erratic heartbeat, gastrointestinal problems, and also muscle and even joint pains for several weeks. A few develop irreversible cardiovascular and even respiratory damage. And if you look at the available data, about 60 to 80% of the individuals who have recovered from COVID-19 may have some form of a sequelae, a condition that is caused by a disease and that lasts even after a patient recovers. So this particular sequelae can either be mild in the form of a fatigue and body aches, but it can also be very serious in the form of individuals requiring to be on long-term oxygen therapy. And even psychiatric disorders are as a result of not just the infection but the lockdown and also social isolation imposed to prevent the spread of the infection. While many people are coming across psychiatric disorders, some who have recovered from COVID-19 have come across many respiratory ailments such as the lung fibrosis, which we are going to discuss today. So to give us more insights on what lung fibrosis is all about, and also to tell us about how to stay safe from COVID-19 and from this particular sequelae, we have with us Dr. Sitesh Roy. Many thanks for joining me in this live interaction, Dr. Sitesh Roy. And my first question to you today is that, there are cases of COVID-19 recovered patients developing lung fibrosis. So could you please explain to our viewers about what this sequelae is all about?
So, Deepak, what happens in COVID-19 is when a person develops COVID-19 pneumonia, they experience a thickening of the lining of the alveoli, which are the air sacs or the air spaces in which oxygen and carbon dioxide gets exchanged in our lungs. And it's almost like a glue-like substance that forms in this area along with inflammation, along with secretions. And for most people, in a span of about 4 to 6 weeks, the COVID pneumonia seems to disappear and the lungs come back to normal. But in a subset of people, which tend to be elderly individuals above the age of 60 or 65, people who have a history of smoking or alcohol consumption, people who have a history of having previous lung disease, sometimes, and even in people who have otherwise been healthy, there are sequelae and consequences where there is scarring in the lungs. And this scarring, much like if you get a cut on your hand and when the wound heals, it may leave a little thickened scar. Imagine such multiple thickened scar inside the lungs where oxygen exchange then does not occur normally and naturally, and the person develops ongoing breathlessness, difficulty in doing day-to-day activities, may even require oxygen for their functioning. And when this occurs, we almost see a picture like a disease that we have known for a while that's called interstitial lung disease. And interestingly, the drug that we use to treat interstitial lung disease seems to help some of these patients who have lung fibrosis. But when the fibrosis goes beyond a certain level, and if the individual is otherwise truly healthy, then even lung transplantation becomes a necessity for such cases.
Also, doctor, now, like you mentioned, the risk is high among those who smoke and drink. So what kind of a damage that lung fibrosis inflicts for the smokers and those who consume alcohol?
So what ends up happening is you have to realize in any infection, there is inflammation that occurs in the tissue that is fighting the infection. So in this case, the area of inflammation where the COVID-19 has entered the cells and the body's immune system is fighting it off, the war is going on in the air sacs, in the air tubes, in the tissue surrounding the air sacs, what's called the lung parenchyma. Now, for a person who smokes and consumes alcohol more than the regular occasional social drinking on a more regular basis, they already have inflammation in their body and in their lungs. And I think that it's a consequence of existing inflammation added on to with the COVID-19 SARS-CoV-2 virus infection causes the inflammation is why the outcomes tend to be worse. At least this is some of the data that has come from Italy, Germany, and other parts of the world, where having these risk factors turned out to be the reason why the person's lung lesions on a high resolution CT scan were not resolving as expected in a span of several weeks after recovery from the infection. Though, as I said, there have been perfectly healthy people who had no risk factors also who have unfortunately developed this fibrosis in several cases.
Also, doctor, now what are the kind of complications that a person who is suffering from lung fibrosis, encounters usually?
So the issues that a person with lung fibrosis would face is basically limitation of their day-to-day activities, because lung fibrosis can lead to breathlessness, sometimes a dry cough, and with it difficulty in so even doing their day-to-day routine in terms of taking a bath, taking a shower, going to work, walking around, taking a routine exercise break, any of these things can become hard if the lung fibrosis is very significant. And clearly a person with lung fibrosis, because the lungs are scarred or injured and then healing in what we call a overzealous way, where the healing has gone overboard and has formed fibrotic patches, these people are at risk for getting infections more than a person whose lungs are healthy and their immunity is normal. So after all of this, oxygen dependency becomes an issue. And if oxygen dependency and the anti-fibrotic drugs are not working as well, then the whole issue ends up with having no option but to be on a lung transplant list, which hopefully is few and far patients between, but still a risk that we need to be aware of, because the people with the most severe outcomes, so those who were in the ICU, those who required a mechanical ventilator for the longest period of time, these are the kind of people who tend to have the maximum damage to their lung tissue and hence the scarring and fibrosis.
Also, doctor, is this, lung fibrosis syndrome or the ailment, is it a permanent damage or is there a cure to this particular ailment?
So interestingly, very recently, Deepak, we have figured out that there is a system in the body called the bradykinin system, which is a very important system, and this system controls the exudation of fluid from our normal blood vessels into our tissues. And there is a condition called hereditary angioedema in which bradykinin antagonists are being used for treatment. So there are certain drugs, as I said, once the fibrosis has set in, then there is a drug called pirfenidone that is used for treatment. And for the fibrosis not to set in, it turns out that these bradykinin antagonists can be invaluable in even preventing. The problem is these drugs are not available in India. They're very expensive and they are given as injections largely. And as we learn more about the disease, hopefully we will have access to these to even prevent the lung fibrosis in the first place.
So doctor, like we have, different stages in cancer, like if you reach the stage 4, it is quite dangerous. Does lung fibrosis also have, certain stages that after which you can't treat it?
Yes, Deepak, in what is called IPF or ILD, interstitial pulmonary fibrosis and interstitial lung disease, there are stages that are given. There are guidelines on these things. Specifically for COVID-19, people have largely followed the existing guidelines. And this has to do with the extent of damage to the lungs and the kind of limitations that it is causing for the individual. So is it only shortness of breath when they try to walk fast? Or is it shortness of breath when they even walk a short distance? Or is it shortness of breath when they are even sitting and laying down? So all of these, along with the picture that we see on the high resolution CT scan of the chest, and combine all these factors together and their oxygen levels at room air and with oxygen, all of these tell us what the severity and hence the grading or the classification of the lung fibrosis is.
Also, doctor, I just wanted to ask you one last question. So, lung fibrosis can be caused even normally without a COVID-19 infection, or is it a sequelae of COVID-19?
Lung fibrosis can be caused due to many different reasons. It has been known to be caused by certain very strong pollutants in the air. It has been known to be caused by autoimmune diseases. It has been known to be caused by other infections, including SARS and MERS in the past have been known to cause some permanent lung damage in some people. So this is not something new. And as I said, over the years, with the growing urbanization and high pollution levels and everything, and also the infections, respiratory infections, viruses, we have been seeing a lot more interstitial or lung fibrosis and interstitial lung disease in general in a country like India, which was not the case probably 10 or 20 years ago. So COVID is adding to that list and number, unfortunately, because that's what is happening. And really, before I end, what I would like to say, if you just go down from head to toe, as you rightly said, from anxiety and depression to loss of smell, loss of taste, which has been occurring for months together in some people, to people who have, even due to the microthrombi or the microemboli, which is tiny blood clots that occur in arteries and veins in the lungs. People have even recently, there have been cases where people have lost their vision due to a retinal artery occlusion or blockage due to these microthrombi. And you take it down to the heart, people have had myocarditis, they've had heart attacks, they've had stroke. You take it down to the lungs, we speak about fibrosis. Take it to the kidneys, people have had chronic renal disease developing after COVID-19. And you've obviously spoken about fatigue, body pain, myalgia, tiredness, all of these things. So this is really something that should wake people up to take immense care of themselves and prevent the infection by doing all the precautions that we have been saying in every single conversation we've had. Wearing the face mask very sincerely above your nose, covering your mouth, making sure you are using hand washing, hand sanitizing, keeping physical distancing. This is so very important till we finally someday have an effective vaccine and getting care and treatment at the earliest sign of disease.
Right, doctor. Thank you for joining me with all those details, and also your message was loud and clear to all our viewers. Primary care is very important. Make sure that you're wearing a face mask at all times whenever you're stepping out, because these the only way that these particles or the viruses can enter your lungs is through your nose and also your respiratory tract. So in order to keep that particular respiratory tract away and clear from viruses, you will have to ensure that you wear a face mask and do not ignore social distancing norms, and also hand hygiene, because we often touch our face to either correct our hair or move our glasses or to wipe our face. So in order to not develop all of these kind of ailments and complications, make sure that you follow all the instructions that were given out by Dr. Sitesh Roy, and also the protocols that we have been emphasizing in each of our conversations day by day. So by doing all of these, you can at least make sure that you are safe and also your loved ones are also safe by you spreading the awareness among your society members. So follow all these safety precautions and stay safe. Until next time, see you and take care. Thank you for watching this live interaction.